All right, YouTube, there's been a strange twist in Obamacare. Of course, if you're watching the news, there are continuing problems with people trying to sign up for health care, and the sites don't work properly. They got completely overloaded. Some people, of course, are seeing nothing that's nearly as cheap as what they already had for health insurance if they already had it. And a lot of people who, for some reason, thought that this was going to be very low cost are suddenly faced with the fact that no, indeed, it's probably going to be cheaper just to take a fine. Ironically, Obamacare was designed to give coverage to the poor, and the poor are the people that are actually going to end up paying this extra tax because they can't afford any of the available programs because they're pinching pennies already. But this is something that I saw posted earlier, and I checked it out. It is true. And you got on some staffer at the White House, someone who's overseeing Obamacare or whatever, is having a huge laugh at our expense. The number, not the websites, although I'm presuming it's listed on the websites too, the number to sign up for Obamacare if you want help over the phone is 1-800-318-2596. If you look at the letters represented by the numbers, that spells 1-800-FUCKYO. It's not a joke. The one doesn't stand for anything. It's 1-800-FUCKYO. So, you know, and there are a few people on these stories saying, well, it was obvious, you're just looking into it too much and it could, spell a bunch of other things. Somebody in Washington right now is drunk and laughing. No clue who it would be who set up this phone number. This is troubling that somebody up there that high up would find this funny. It's obviously somebody's idea of a joke. It's obviously amusing to them. Who is responsible? There's no way to tell. Of course, Obama probably didn't choose the number, but still, shouldn't somebody have vetted this number and thought of this unfortunate phrase that's spelled out by the Obamacare number? It's mind-boggling that this got through and that nobody, of the thousands of people who had to have checked this number out to set up these systems, make sure everything was working, who had, inside knowledge of everything as it was being set up. It's troubling that nobody noticed this, or that if they noticed it, they didn't say anything. Not a huge issue with the plan itself. It has its own issues, but still, 1-800-FUCK-YOU? You can't get any more blatant. This is too funny to even be joking about. Call the number. 1-800-318-2596. Call it. It takes you right to the healthcare exchanges. It's the official number of Obamacare, and it says 1-800-FUCK-YOU. Who did this? Somebody is laughing so hard. I'm laughing too. It's so ludicrous. It's so ridiculous that you can't make this up. Literally, either that or everyone there is so completely incompetent that they literally randomly chose this number of millions of available phone numbers and it just happens to spell this out. You can't make this up. It's beyond, literally, it's beyond coincidence. There's no logical, rational way to explain this away as well. It was just the number that they chose and nobody noticed. Somebody knew what this was going to say. Somebody made that decision in a conscientious manner and decided that that would be the number for the healthcare exchanges. It could be someone, here's the ultimate laughing point. It could have been somebody who leans to the right and who said, well, I've got a great idea for a joke, so I'm just going to change this and log this as the number that's going to be assigned to the healthcare exchanges. But still, I mean, this is ridiculous. And Obamacare is having its own problems. And I think the thing which is going to undo Obamacare, I think, is that a lot of people assumed this was free healthcare coverage for the poor, or if not free, that it would be very, very subsidized. It would be very, very cheap. You're looking at maybe $100 a month. Even most of the really poor individuals would pay $100 a month for health insurance if they could, because they potentially get more back out of it than they're paying into the program. And you hear Obama on TV, he was talking earlier, oh, well, million people visited the site. What they're not telling you is that only a very small percentage of the people who have visited the site have signed up for any sort of care. Now, part of this is due to the fact that a lot of the states that are covered by these numbers and websites, the websites and numbers got overloaded. So people physically aren't capable at this moment of signing up. A lot of it is, and people were expressing dismay at this, a lot of it is that the same people who aren't covered under health insurance, a lot of people in the middle class have lost health insurance now because they've been cut back in hours and so forth. The poor were primarily the ones that were supposed to be getting new health coverage under this. The idea was you get young people involved to pay, mainly to pay for the program, get them on the exchanges because a lot of young people don't have health insurance. And the idea was you could balance out the cost by getting the poor onto these exchanges at a subsidized rate. The problem is people aren't signing up for Obamacare, for this so-called affordable health care, because they're seeing their expectation of the price was far lower than the actual price. Even if a few people are saying that they're saving a lot of money, that their new insurance under this plan actually is quite a bit cheaper, and to them, of course, this is a great program. There have only been a few cases where people are saying this, though. Most people are saying they're paying about the same amount, or they're basically saying this is too expensive, they're opting out completely. And for the poor, for the people who are really hurting, who are the ones who are supposed to be able to afford coverage under this program, they can't afford to pay this sort of, it's essentially a tax. They can't afford to pay the fee for not getting insurance. At 2.5% of their income may not be very high. The problem is it's whichever's higher, and there's a fixed number, and then that percentage of their income. They can't afford to pay that. They can't afford to pay for the health insurance under these programs either. What a lot of these people believed was that this was going to be essentially free health care. That's what the government, it's not necessarily what they were told, it's what they inferred. What a lot of people inferred was that this would be essentially free health care for people who are of low means. The idea was if you get everybody onto the exchanges, then the rich and some of the upper middle class people are subsidizing healthcare for everybody else. So you have a gradient of cost. All people, supposedly, it would lower the price of healthcare for everyone, potentially, but that it would balance out. It would give everyone at least rudimentary healthcare. It's not working. We're only 3 days into Obamacare, and it's already showing signs of immense strain. There are already thousands of people talking about how they can't afford any of the plans that are available to them, how they're simply going to not get health insurance as they didn't have health insurance before. And then you've got millions of people who have lost health insurance coverage because a lot of businesses have said, we can't afford it for our full-time workers, so we're going to cut them down to part-time. So people who before were making a decent living wage and had health insurance through their employer now have less hours, which means less money. They have no health insurance, and they're relying on welfare. Again, as I pointed out before, a system which would have been a good idea on paper, which did not pan out, which is why I think they should get rid of Obamacare. They should keep pre-existing conditions coverage. I think that was a very good idea. There should have been a separate bill to prevent discrimination against those who had pre-existing conditions. That was a very good, very humane, and let's face it, overall relatively affordable idea. They could have raised some other tax by $3 or $4 a year to cover that amount of people that would have gained additional coverage for their conditions. It's really fairly straightforward, but to force everybody onto these exchanges, except the millions of people who were exempt, who work for the federal government or for certain unions, which was marginally illegal to begin with, it's simply not a working system. It's not working. Be pragmatic. When you look at a bill, you have to look at whether it, in the real world, once it's implemented, if it works. We're 3 days in and it already is showing signs that it's not really going to work because a lot of the people who were supposed to be covered, the goal of the program being get as many people onto health insurance as possible, are choosing not to be covered because they cannot afford it. It's as simple as that. It did not work. And to have this this retarded phone number, 1-800-FUCK-YOU, as the phone number to sign up for Obamacare makes matters worse, because it shows that someone in this program at a higher up position is having a good laugh at everyone else's expense. And because these programs bounce things around all the time, there's not going to be any trail back to who authorized this number to be used, so they'll never get in trouble. For all we know, Obama could have said, oh, that's a great idea. I think this will be hilarious to joke around with the Republicans. We have no way of knowing, because there's not going to be any paper trail. But it's become everyone's worst nightmare, essentially. It's become exactly what a lot of people proposed in the beginning, and they were sort of laughed at for suggesting this, but it's become another tax. Even a tax on the poor. Which, where's that money going? Well, it can't possibly be used to subsidize the program, because not that many people are going to end up signing up for this. Certainly not a lot of people who would require a subsidy to purchase their health insurance. A lot of the time, what you're going to see is people in the middle class who already had insurance but lost it are going to enter the program and pay about the same amount. There'll be a few rich people who will take it just because their own personal income would mandate that they pay a hell of a lot more than by buying insurance. You'll have a few poor people who are fortuitous enough to live in a state where it's going to be relatively inexpensive. For those who lived in states where they already had access to affordable health care, this is a disaster for them. And for poor people who can't afford to pay that static fine, what are they going to do? They're going to end up in debt to the government further and further every year. It's a terrible idea, again, good idea on paper that simply didn't pan out. So now should be the time when either this system is reformed or done away with, essentially. And people, I know that there'll be people who come to me and they'll say, well, you're siding with the terrible evangelicals and Bible thumpers and corporatists in the Republican Party, and you don't understand because the Republicans aren't willing to work with the Democrats on a totally unrelated issue, which they keep harping about, and the Republicans keep harping about it too. Again, pragmatism. Does it actually work? The answer is, so far as we can tell, no. Even the websites don't work. And this phone number is fucked up. Very poorly handled. The thing is, if you're going to have a program like this that's so massive and so far-reaching, you need to make sure that it's actually going to work for the majority of people who use it, which does not, unfortunately, seem to be the case. If it did, it'd be a fine program. If it did, then tens of millions of poor people would be on this program, and most people would choose to buy health insurance because it'd be cheaper. That was the goal to begin with, to give cheaper, more affordable, at least rudimentary care to the poor and to the lower middle class who actually need it, because everyone else already had health insurance. What it ended up accomplishing is kicking middle and upper middle income people off health insurance, which had been guaranteed to them by their employers. It ended up making certain businesses fold altogether, or they cut hours so that everyone's part-time. And the poor still aren't going to enter the program. Now, we'll see in the next few weeks and months if it gets better, which is possible. It could be that these issues will be taken care of through some sort of congressional action, through some sort of executive action. It's possible that it'll get better. But if things continue at this rate, with only a few people actually signing up for these programs, it's not going to work, and it will collapse under its own weight, as certain people have already suggested.